Well, welcome back from lunch. I hope everybody had enjoyed their meal, and we're going to come back for the latter part of our program. I'm going to be introducing Dr. Richard Sagall. Dr. Richard Sagall has created a website that you're probably familiar with from the literature you have on your table, or you've heard about it already, NeedyMeds.org. He's going to explain to us step by step how this program can benefit patients with cost-saving measures, programs that are not advertised in the normal sector, magazines, newspapers. They've done all the research to gather this in one handy website. And Dr. Sagall is going to share all this information with us. And so I will take this moment to introduce Dr. Sagall and let him help you explore this website. Thank you.
Thank you. I want to thank everyone for coming out. Is this on? Working? How's that? Huh? Can you hear me now? Okay. Now you can hear me. All right. I've been adjusted in the back. I want to thank everyone for coming, and I want to thank the organization for the invitation. NeedyMeds has worked with the Scleroderma Foundation in Danvers, Massachusetts for a long time. It was actually the first disease-related organization that NeedyMeds worked with. We've used them as the prototype for a number of different programs. So again, I want to thank you for the invitation. Just a couple of quick questions. How many people here use the internet? Anybody who doesn't? Well, that's going to make it a lot easier. The second question, has anybody here ever had trouble or had to make hard decisions as to whether they could afford the medications that were prescribed to them? Fair number of people. How many of you have known people that had to make those decisions? How many people here know people that had to make those hard decisions, but they never told them? Probably everybody. What I'm going to do this afternoon is talk briefly about NeedyMeds and what we do so that you can use it, you can help yourself, help others who are having trouble affording medication and healthcare costs. NeedyMeds is a nonprofit. We're a national organization, and what we do primarily is provide information on programs that help people who cannot afford medications and health care costs. Even with ACA, the Affordable Care Act, no matter how you feel about it, there are still going to be lots of people who don't have health coverage, and even those that do are going to run into situations where they can't afford their medications. There are many, many programs out there that will help people who can't afford medications. Some help with actual medications, giving them away for free. Others help with copays. I'm sure many of you are on medications that have high copays, even though you have insurance, and that may put a financial burden on you. And there are many other programs. NeedyMeds is primarily an information source. We have data on all of these programs. And I'm going to run through these programs quickly because there's a lot to talk about. I really want to encourage you to go to the website. If you use the internet, the only thing you have to walk away from this portion of the talk is www.needymeds.org. There is a handout, I believe everyone has one, that shows a little bit about how to use the website. My goal and our goal at NeedyMeds is to make sure the website is easy enough that it doesn't take much explanation as to how to use it. Let me start with what are called Pharmaceutical Patient Assistance Programs, or PAPs. These are programs run by pharmaceutical manufacturers that give away free medication to people in need. They will not announce or reveal exactly how much they give away, but it's in the billions of dollars, probably $8 to $10 billion worth of medication every year they give away. Most of these programs are totally free. Now, the drug companies don't have to do that. There's no rules or regulations that require them to do it. And no matter what you think of drug companies, whether they're good, whether they're bad, or whether they're someplace in between, this is one of the good things they do, because they do help millions of people who can't afford medications. The programs are all different, which makes it a little confusing. They all require an application. They all require some information concerning your income, insurance, and residency. Some of them may require a lot of information concerning diagnosis, concerning treatments you've had, etc. Others require very little information. So they're all different, and that's important to remember. When you're looking for help with medication or costs, or if you're helping somebody, and that's part of my goal, is to have all of you become advocates and be able to help other people apply, you want to check for every medicine. Too many people make the mistake of saying, I'm on 5 medicines, this one's expensive and I can't afford it, these 4 are relatively inexpensive and I can afford them. You want to check every medicine you're on, because maybe you'll get enough help with the inexpensive ones to be able to afford the expensive one, or at least put less of a drain. What I'm going to do is walk through the website and show you how to use it quickly, but there's a lot of information there. Just to give you an idea of how busy we are, on most work days we get around 15,000 unique visitors to the website. That's a lot of business, that's a lot of traffic, and that's great. My only concern is it's not enough, because I know there are lots of people out there who could use the information we have and they don't know about us. That could be individual patients, advocates. When I talk to social work groups or other advocacy groups, many people know and love us and sign on to our website at the beginning of the day and stay there all day. And other people sitting at the same table have never heard of us. And we try hard to get the word out. When I talk to physician groups, many of them don't know we exist. So we need your help to help spread the word about what we do. Most people, when they come, they go to what's called the patient savings section, and you can see this lists all the different types of information we have. So we have information about drugs. We have information about programs that help people apply to programs. We have over 13,000 free, low-cost, and sliding scale clinics. We have coupons. We have programs that help people based specifically on their diagnosis. So I'm going to go through a few of these. Where most people go is to brand name drugs. And we're a little slow here on the internet. There we go. This is a list as of today of over 4,500 different drugs that we know of that have some type of assistance program. Some of these programs may give them for free, may offer them at reduced cost. We try to get every single drug we can listed. And obviously that's of today. Now, nobody was in today. This is automatic. I'm not that mean. We don't have people work Saturday and Sunday. This just talks a little bit about the information. We have a list. We have what we call an alpha bar. So if you want to find a drug, you'd click on the first letter. I'm going to use Abilify right here as an example. And you'll notice there are a couple of icons below it. The first one says View Coupon. That means we found at least one coupon for this drug. Some of the coupons help only a few dollars. Some of them will help hundreds of dollars. So if we click on this, as soon as it loads, it takes you to the coupon page. So here's a coupon for Abilify. Now this is one of the more generous coupons. 30-day free trial plus up to $150 off refill costs. So it's an expensive drug, or they wouldn't give you $150 back. But if you could use this coupon, and you can save quite a bit. And then if you click right here where it says Manufacturer's Offer, it'll take you to a page, I'm not going to go to it, which gives you all the details from the manufacturers to how to apply. Some of the coupons you can just print them right off. This one you have to apply. So let's just go back. We also have this, View CR article. CR stands for Consumer Reports. They've put out a series of what they call Best Buy drug information. There's a booklet, and they have information on, I forget how many drugs now. I feel privileged that they're willing to partner with us and let us put their information on the website. So if you click on this, it'll go to a page that talks all about the drug, about costs, about alternative, gives you a lot of information about the drugs. It's not there for every drug, but it's there for a number of drugs. Just gives you a little more information, helps you make the decisions you need to make, like Seth was talking about earlier today. Now, if you click on Abilify, or any drug, it loads up what we call the program pages. This talks about the individual programs that help with the drug. And we have the basic information. It's by Bristol Myers Squibb, contact information. This is their application. If you click on this, it will open up what's called an interactive PDF. Most of you are probably familiar with PDFs where you can get a form. Interactive means you can type into it. So you can click on each field and type the information right in. Then you can print it out with all the information on the application. Unfortunately, you cannot save that. You have to print it at the time, and that's a function of how Adobe designed PDFs, not anything we do. Let me stop and just say a word about completing applications. Every program has an application. We have most of them. Now, a natural question is, why don't you have all if you say you're so good? We don't have all because some of the programs want to mail you an individualized application. Some of the programs do a pre-qualification on the phone, so you don't apply if you don't qualify. We have most of them. Our information is kept current. We have 2.5 positions in the office, and all they do is verify and update and find new programs. So if we don't have it, it probably doesn't exist. And I say probably because we're not perfect. We're close, but not quite. So if we don't have it, and you know of a program, please let us know. But we are always updating the information. Going back to this, talk about the medication, Abilify, and gives different dosages. Talks about the eligibility requirement. So for this program, you must have no prescription coverage. Now, what does that mean? It depends. It may mean your insurance doesn't provide coverage for any drug, or it may not be for this drug. So you have to check. If you have on Medicare and Part D, in this case, they consider it on an exception basis. That means you call the program, check with them. Income, you have to be at 250% of federal poverty level or less. The federal poverty level, or FPL, is something the government defines. It's extremely low. And we do have an FPL, what we call calculator. If you click on this, it opens a little calculator. You can put in your income, family size, the state where you live, and it'll tell you what percent of FPL you are at. Very handy so you can see whether you qualify. Diagnosis and medical criteria. Some of the programs do want a specific diagnosis. This one says it's for outpatient use only, so it varies. U.S. residency required, and we have that information. And again, it varies. Then how do you apply? Well, you can call or download it. How do you send it, et cetera, et cetera. I won't go through all this. And then it tells you about the medication, how much you receive, where it's sent, how long it takes, et cetera, just to give you an idea as to what to expect. And again, the programs are all different. Some of them will only send them to a physician's office. Some of them will only send it to the patient. Some will do both. Some will send a coupon so you can go to the pharmacy and get it. You always have to reapply. They're only good for a certain length of time. And this one has no limit. If you continue to qualify year after year after year, they'll help you. Now, we have a second program. And if you notice right at the top here, it says Program 2 of 2. Some drugs are on more than one. Another Bristol-Myers Squibb program. I won't go through all the details on it. You can see it's all basically the same, the layout, the format of the information. We try to make it simple. We try to make it easy to read. Now, at the bottom of every page, right down here, it says you can't reproduce this in any form except for personal use. Ignore that. You reproduce this all you want. The only reason we put that in there is we found some websites that were stealing everything and putting on their website. And we want to get credit for what we do. So that is the basic information where most people go to find a drug that they need help with. Any questions on this? No? Good. Hopefully that means we succeeded and made it easy, not that we overwhelmed everyone, they don't understand it. Now, if we go back to the home page, oops, here we go. Under patient savings, we have the same information organized in different ways if you want to look at it differently. So if you want to do it by generic name, if you know the generic name of the drug, same basic setup. I won't bore you with the details. If you know the program name, if you know the company name, and just to show you an interesting thing here, AbbVie, which used to be part of AstraZeneca, this is how many different programs they have for different drugs, for different types of drugs. If you are on more than one, you'd have to apply to each one separately. So you can see it can become a monumental task. We have people who call us who are on 20 drugs and need help. And they may be eligible for 20 different programs, 20 different applications. Unfortunately, there's no single application yet, and I don't think there ever will be, because the pharmaceutical companies are very fearful of anything that smells of antitrust, so there won't be a common application. Anyway, just to give you an idea of that. We do have a list of the program applications. If you know what you need, you just want to go to the application. As I mentioned, I'm going to move on. These are programs that help people apply to programs. If people have literacy issues, computer issues, other issues where they just can't handle it, we know of about 1,000 programs throughout the country that will help people apply to these programs. We had people call us and say, my drug is on a PAP, I qualify, you're a doctor, will you write me a prescription? Because I can't afford to go to the doctor. And of course I had to say no, it was illegal, unethical, I couldn't do that. So what we said is, but we can help people find doctors. So we have a list of, does it say here? Well, it's about over 13,000, here we are, 13,476 free, low-cost, or sliding scale clinics. So, and this is changing every day. We have people who work on this every day. Do you have a question?
Just a quick one in general. Do you handle holistic clinics/medications?
Depends what you mean by holistic. If you mean what's considered alternative therapies, no. Another whole talk I could give someday on alternative medicine, but we don't get into that. You can find a clinic by putting in a zip code and then going a radius around it, or you can do it by a state. So in California, where we happen to be, we know of 1,301. Now these numbers change every day. They come, they go. They may be large free clinics that are established, or it may be something that happens once a night with volunteers in the basement of a church or a synagogue or something like that. So they vary quite a bit. And we give you the information on the clinic. So here's the first one, and you can see it's the basic information. We give you a link to their website, a map. If you wanted to print some of these out to give to somebody, you could print all 1,300, but that would waste a lot of paper. So you could just click on the ones you want to print. So if you just wanted to print the ones in Alhambra, and that's all that would print. This, as I said, is changing all the time. But it's a useful resource. This is probably like the 4th or 5th most visited page on the website, looking for free clinics. So there's a lot of people that need help with that. Coupons, rebates, and more. Relatively new section to the website. And currently, let's see, we have almost 1,700 coupons for almost 1,500 different drugs. Obviously, some drugs have more than one coupon. Either that or our math is off. Over the counter, so you save $1 on A&D. No big deal, but $1 here, $1 there can add up. So, and again, it's very simple. We give the information. So if we look at this one, for example, it tells you you'd pay no more than $35 for each prescription for this drug. So if your copay is more than that, it would help bring down the copay. Unlimited duration, and you would just click to get the information. We're always looking for more. Now, I want to point out right here, please email us with corrections or additions. As good as we think we are, as I said, we know we're not perfect. Things change all the time. Dee, who does most of the coupon research, double checks every coupon every month. Well, she's always looking for new ones. But we know that you folks may know of a coupon we don't have listed. If you do, click there. It'll create a little email so you can send Dee the information. She'll add it to the website. We want this for any program, anything you see. Some of the things we put on the website have come as suggestion of people who use the website saying, how come you don't have this? So when you look at this, if you have ideas, please let me know, because we want to grow this. So that's coupons. Again, I'm not going to go through all the details. Except for one lady who's going to get her daughter to help her. Everyone else uses the internet, so you can check this out yourself. Diagnosis specific. These are programs that help people based upon their diagnosis. It may be they help with a co-payment for a drug that you're taking. They may help with medical expenses, with travel expenses, all sorts of different things. There are a few programs that will just help people who have a serious chronic or life-threatening disease and need some extra cash. Some of the programs are national, some are regional, some are local, some are statewide. So again, it's something that you need to check. And you can search in many different ways. So if you do by diagnosis, oops, there we go. You can see we broke it down again. So here's one, I just saw one. What was it? All diseases requiring medication. So we know of 4 of them. They're local, but they do help. If you know of any others, California may have some other programs. The national ones are pretty easy to find. The local ones are very difficult to find. It's hard to know what to Google them for, what words to put in there. So if you know of a program that we don't have that provides assistance, and right now this is limited to financial in one way or another, please let us know. So there's all sorts here. There's some alopecia, which is hair loss. Alopecia areata is where people lose hair and only in certain areas, or usually in the hair where they get clumps just falling out. There are people that will help with wigs. Amputation. There was an interesting one, if it's still there, which would help people but not felons. Why, I don't know. If it was a misdemeanor, they would take it on a case-by-case basis. So you can see there's lots of help available. Some of it is pretty quirky. Some of these programs run out of money. Others can't give it away. So I strongly suggest spend a little time looking there. So we broke it down different ways. We also have camps and retreats based upon diagnosis. Now, mostly for kids, either who have a disease or come from a family where someone has that disease, and camps. And then we also have scholarships, number of scholarships. I think we got 300 or 400 of these now, and I'm sure there's more. And they don't have to be big scholarships. A couple $100, we want to list it. They can be very local. So that covers that area. We have government programs, state-sponsored programs for specific diseases. So we list all of this. I'm not going to go through all of these things. But that's the basics of the information that we have. Is there any question on the information before I go on to the next part? Yes?
Yes, would NeedyMeds have any information like for dentist work? A lot of the stuff that I deal with is like dental work, and they're so expensive.
Right now in the free low-cost sliding scale clinics, we do include dental clinics, either those that are dentistry only, or it's a clinic which has dentistry as part of their offering. So you could do a search in the clinics, I believe, for dentistry. I say that now and I'm not sure, because we've been discussing adding that. So you could find just the dental clinics within a certain state or a certain zip. But yes, we are adding that.
Excellent. Thank you so much.
Any other questions on the information? Good. Okay. Now I want to go back to the home page, and we'll get to that in a second. And I want to point this out. I think everyone should have on their table a little plastic card that looks like this, but it also says Scleroderma. Did those get distributed?
The cards are in the back.
The cards are in the back. Everyone should pick one up on their way out, or if there's more, take as many as you want. NeedyMeds offers a free drug discount card. This card is accepted at over 63,000 pharmacies, pretty much every pharmacy, all the big chains and most of the small ones. Individuals who use it can save anywhere up to 80% off the cash price of prescription drugs, over-the-counter meds and medical supplies written as a prescription, and pet prescription drugs you buy in the pharmacy. Depending upon your outlook, either we use the same drugs they do or they use the same drugs we do. But particularly for mammals, many of the drugs are the same. Some reptiles, I've heard they take the same drugs. I don't know. Never had a reptile as a pet. In any case, with this card, as I said, you can save quite a bit. We're saving people about $2.5 million a month. Now, there are a couple of limitations. You cannot use it with insurance. It's the card or insurance, so it will not lower a copayment. Most of the time, your copay is going to be less, to be honest, but not always. About 5% of the time, the card will do a better job. You cannot use it, what was I going to say, with state or federal programs. So it's cash paying only. You want to remember, just because you have insurance, you do not have to use it. And pharmacists will tell you that. Or you have Aetna, you can't use the discount card. That's not true. It's just like if you get into a small fender bender, you don't have to use your auto insurance. You can say, forget it, I'm going to pay for it myself. So with the card, as I said, you can save quite a bit. The savings so far, we estimate to be about $56 million since we started. Now, the Scleroderma card in the back says Scleroderma on it. Each time the card is used, a small amount goes to the National Scleroderma Foundation to help them. This card is good any place in the country. Anybody can use it. Now, there is no registration with the card. There is no sign-up, which is important because that means there is no tracking by individual. We do not know who's using the card because I have no reason to know. Now, many other drug discount cards out there, you have to sign up. They put your name on the card. It makes you feel important. What they're doing is they're tracking your information. So somebody who uses one of these cards and gets some diabetic supplies, all of a sudden they start getting emails or mails, offers for diabetic supplies. That'll never happen from us because we don't get the information. So that's real important to know. Any questions on the card? Yes?
Generally, how much exposure have you had on the local media?
Not as much as I would like. We've been exposed, we've been on a number of different programs, but not as many as we would like. And again, any way you can help us, this is what we want. We have all sorts of partnerships with communities, with other organizations, with anybody who wants to give out the card. We'll put their name on it. We actually pay them a small amount. Now, I have to admit, it's what we call an honorarium. The whole drug discount card business is very complex, and the savings can vary quite a bit. I suggest if you have a couple of cards, go to the pharmacy and ask them to check the price. Now, they're not going to be willing to do every price for lots of different drugs because it takes time and it actually costs them a little bit each time they check it. Now, some pharmacists are very good. We know of a number of pharmacists who keep the cards in their pocket. If someone comes in paying cash, they say, here, ask me about this. Ask me to use it. Other pharmacists don't want to be bothered. One way to divide pharmacists is into those that have customers and those that have patients. Those that have customers want to count the pills, collect the money, and say goodbye. Those that have patients want to help their patients get the meds no matter which way it is. If they're not the cheapest, they may want them to go someplace else. They may want to give them the card. So you have to fight for this sometimes. We get people calling, not real often, but sometimes saying, the pharmacist said it was no good, I haven't registered. I say, no, there's no registration. I haven't signed up, there's no sign up. It's expired, there's no expiration. As long as they're accepting discount cards, this one will be accepted. When you get the card, if you look on the back, there's information for the pharmacist and a number for the pharmacist to call. There's information for the patient and a number for the patient to call if they have questions.
Right.
Any other questions about the drug card? Please, if you need more, there's a number on the top of the website right here, this 800 number. That's our free helpline. If you have questions about NeedyMeds, if you have questions about the drug card, if you have questions about anything, give us a call. We can't give medical advice. But other than that, we can help. About half. Good. Just trying to keep track of time. Now, there was also another sheet handed out, a one-pager that said Heal Funder. This is a new program we have that we're very excited about. It's been up only about 3 or 4 weeks, and I want to explain this to you. How many people know what crowdfunding is? A couple people. Maybe you've heard of Indiegogo or Kickstarter. Crowdfunding was started when some people said, I have this new business idea, but I need money to do it, and the banks won't give me the money, my relatives won't give me the money. Let me go to the crowd, to people in general who use the internet, and see if they'll give me a little bit of money. So for example, let's suppose somebody wanted to start a pickle business, and they didn't have the $100,000 they needed to start the pickle business. They could put their campaign up on websites like Indiegogo, Kickstarter, and there are many others. Describe their business plan, describe how much money they need, and then they would set up different donation levels. So maybe if you gave them $5, they'd send you a little pin that says Rosie's Pickles. Okay? That's my wife, Rosie, so I'll use her. And if you give them $25, they would send you a bottle of pickles once they get up and running. So if they raised $100,000, they would start the business and they would send it. That's called crowdfunding in a nutshell. Then people started to say, well, maybe I could get some money to help me with my medical expenses. That's called medical crowdfunding. So what we decided to do was to set up a website called Heal Funder as a place for people to pose their campaigns to see if they could get help. So right now we have two, and let me explain these to you. Let's look at this one right here. This is from somebody whose son, I think he's around 16, a number of years ago, lost a front tooth. It's gone. And they don't have the $5,200 to get the implant and all. And it really, as a 16-year-old, you can imagine that would embarrass him. So what she's trying to do, she just started this campaign maybe a week or so ago, is ask people, friends, family, strangers, could you help me? Just give me a few bucks so I can raise the money. Now, we designed Heal Funder to be a little different than other crowdfunding sites. You've probably all read in the newspaper about people who usually they claim they have cancer, raise all this money, and then it turns out they don't have the disease. We wanted to prevent that so that anybody who starts a campaign has to send us some documentation that they have the disease. Now, it could be as simple as a note from their physician saying, this person has scleroderma. Good enough. We're not looking for detailed information. We don't want to know much about you, just enough so we feel comfortable you have the diagnosis. Anybody who signs up for a campaign, we try to counsel them on all the resources we have. Maybe we can help them lower the cost with meds or whatever. The third thing that differentiates us is that we do not give the money to the person who's running the campaign. They send the bills to us. So this kid, let's suppose they raised the money. We're not going to just give her a check for $5,250. She's going to have to send us something from the dentist, not the orthodontist, but whoever does the implant, etc., saying this is what it's going to cost. We'll send the check directly to that person. Let's suppose that people are generous and she raises $8,000. She doesn't need the extra $3,000. She doesn't just get it. We would go back to the donors and say, this person beat their goal. What do you want to happen with the extra money? Do you want us to give it to her anyway because she's a nice lady? Do you want us to just give it to some other campaigns? Do you want it back proportionally? So the donors have control over the money. So that's why we set this up. And we've just started it. We're looking to get a couple more campaigns before we go national on this. But I think it's going to make a difference because there are a lot of people out there who are going without because they just can't afford it. Any questions on that? No questions. Good. So we really want your help. Check out the website. If you're feeling generous, we'll take check, money order, credit card. It's all set up. Now, the other thing I want to mention is that our fees for running this are extremely low. And our goal is to lower them even further because we don't need to make money. As a nonprofit, we don't want to make money off of this. There are many for-profits that do the same thing. With everything we do, we give it away. To individuals, everything is given away totally free, no questions asked. All the information, the drug card, etc. So that distinguishes what we call Heal Funder, or this medical crowdfunding site, from everybody else. Any other questions? Any questions? If not, I'd like to go back to what Seth was talking about this morning because it really struck what I do. Because just recently on another website that we have, let me just load this up. Which is our, org.
Dr. Sagall, while you're talking about that, I know somebody mentioned if they were needing a stem cell transplant, this is something that they could do because that's quite expensive. Is that true that they could, go into that system and set that up?
They could set up a Heal Funder campaign, anything medically related. We're not really going to be judging whether it's appropriate or not within certain guidelines, because that's up to the people who are donating. They can read all about the campaign. So for example, if somebody wanted money to go to Disneyland because their child is dying, well, that's fine. That was their last wish. This is what they want. That's fine. But they would have to put the Disneyland trip in the campaign. If they didn't put it in the campaign and sent us the slips, we'd say, sorry, you can't do it because you didn't put it in the campaign. Or if someone wanted a new car, maybe they need a reliable vehicle because they have to go 200 miles 3 times a week to get treatment, and they can't make it half the time because the car dies. That's a legitimate expense, not just because they want a new car. So definitely. And if there's any questions, you can call the office and ask for Evan. Remember, we're on the East Coast, so the time's a little different. And he'll be happy to help you. His job is to help anybody who wants to set up such a campaign. So any other questions? Seth was talking about how to get the most from your physician visit. And he's right. It's really up to you as patients to get the most you can from the visit. I did a blog post a little while ago just on this topic. I don't know if I can make this bigger. But I thought I'd just run through these really quickly because as a physician, I know what makes a better visit. And I know what patients can do to make a better visit. I think the first thing is expectations. Make it clear when you go into the doctor, what are your expectations from this visit? If you want to talk about the medicine, you should bring that up right away. Because I've had, and I'm sure every physician has experienced, the patient who comes in, the doctor thinks they know what the patient wants to talk about. You go through all this stuff, and at the last minute as you're walking out the door, it's, oh, by the way, doctor, and shoots the whole schedule. So if you have certain expectations, doesn't mean they're going to be met, but at least make it clear. The second thing, which I strongly encourage, is take a family or a friend or a family member with you. Many studies have shown that patients remember very little from an office visit, and most physicians overestimate how much the patients remember. You bring somebody who is not the one who's experiencing the stress from the visit, the stress of the diagnosis, the problems with the medication. It just helps. They're probably just going to sit there as a silent witness almost and maybe note taker, but I think it makes a world of difference, and I strongly encourage that because people normally don't remember. Doctors don't remember if they're the patient what their doctor told them with all the added knowledge they have. I always found it helpful if a patient brought a written list of questions, and that helps in many ways. One is it forces you, the patient, to really think about what you want to get from the visit. You have to be able to write it down. And then when you bring it, don't bring one copy, bring 2, and just give one to the doctor and say, this is what I need to know. Leave room so you can write information right on there. It makes it a lot easier for the physician. We don't have to try to read your minds and figure out what you want. Have a good history. This is critical. Somebody comes in with headaches and says, geez, doc, I have headaches every day. Well, what do you mean? How bad are they? Do you really mean every day? Have you kept a diary so we know what's going on? You want to write down things because we all forget. We all tend to overemphasize certain things. We all have biases in terms of what we remember, what we don't remember. So bring that information with you so you can say, I have a headache every Monday, Wednesday, and Friday. It starts at 8 o'clock and it's gone by noon. Then at least we know what's going on. And then we're all on the same basis. And if you write it down, for in my case, if I wrote it down legibly, it makes it easier for the doctor because they can just read the diary and see what's going on. So I strongly encourage that. Ask about tests. This is a real issue. Doctors like to do tests. Doctors like to do tests because it gives them good information, because it shows that they're supposedly doing what they're supposed to do. It helps cover their ass if there's anything that goes bad. But oftentimes when you really look at it, there may not be the need for the test. Now, if your insurance covers everything, maybe you're not so concerned. But if you're paying out of pocket, it does make a difference. And the single most important question you should ask a physician when they're going to do a test is, how will it change your treatment course? If it's not going to change it, why do it? Now, not all doctors may not agree with that, but you need to keep that in mind, and that's just a good question to get doctors thinking. The same way we all should have learned, physicians should have learned, that you never treat a test, you always treat a patient. A single test result doesn't mean anything in isolation. You always have to look at the total picture. The next one I feel very strongly about, which is get your test results. You should get a copy of every single test that's done. Never accept the no news is good news approach. Because what does no news mean? It could mean it's good news. Everything's normal. Don't worry about it. It could mean the doctor never got the test result back and didn't know that. It could mean they got it back and the doctor didn't review it. It could mean they got it back, the doctor reviewed it, but somehow the information wasn't conveyed to you. So you should get some notification on every single test. And lastly, and this one may be a little controversial, but I think you should ask for a copy of the doctor's notes when they're done. When I was in practice, I made it a point of trying to dictate, this was before electronic medical records, dictate my note on the patient visit in front of the patient before I left the room. Now, when you were talking about asking the doctor what they're typing in there, in this case, they may say, Doc, will you just read aloud what you're typing in? They should be able, most of them aren't that good at typists, so they should be able to read while they're typing. Shouldn't get ahead of themselves. But you want to know what's in there. Now, most of the time, doctors will not and should not change what they put in the record. Recorded right, recorded wrong, you should never go back and change it. They can put an addendum in there. And if they get something totally wrong or significantly wrong, you should ask them to do that. It's not easy. None of these things are easy. My wife said, oh, you talk all this stuff, but it's not easy. I agree. It is not easy to do. But as things are changing, you need to become active and educated partners in your health care. And this is an important part of it. So I will stop with this little extra. And that's a handsome picture of me there. You can go to this blog. It's blog.needymeds.org if you want to read the details. And I'll entertain any questions. Otherwise, I'll be done. Any questions at all? No? Okay, please use the website. Tell your friends. Tell people who may be experiencing difficulties financially. Use the website. Same with the card. If you want more cards, just call. We'll be happy to mail as many as you want. And if you do call, ask for the Scleroderma card so that way your national organization gets credit. Thank you very much.
I just want to thank Dr. Sagall for his yet another form of our educating ourselves about the programs that are out there. Again, that there's not a whole lot of advertisement about. Excuse me. And I do want to add just one thing. I did this sort of work about 12 years ago when I was a pharmacy technician for some of my patients. And it was painstakingly. I mean, it was Googling and failing and Googling and failing. And it was forever to actually reach the source of information. And the fact that he has made this a 15-minute sit down with your computer and it's all condensed and easy to do. It's such a gift for everybody, and I really encourage everybody to get on that website and pursue what the things that you need help with. Thank you, Doctor.
And yes, thank you, Dr. Sagall. I said Sagall because I was thinking of the actor when I was talking. So
Happens. That's okay.
And I just want to thank you very much because I learned a lot of things that I can share with friends and family that had no clue about this. What a resource. My cousin, Elaine, diagnosed with lupus. I mean, this is going to help her, and scleroderma. There's a lot of us out there that really, really need this information. So thank you very much.
Thank you.